All right, guys, we're here with not only just a patient, but he's become a pretty good friend. He's been around just a little bit. So, Doug, this is Doug, by the way.
Hello.
What patient number are you first? Let's start there.
I am number 79.
79, which we started with patient 1 and we're up to like 7,000. So he's been around chiropractic for a little bit. All right, and his wife has also been a patient. She could not be with us today, but she's also patient number 88. So he's been around for a while. So let me ask you some questions. So when did you, Doug was with me my very first year of practice. We opened in January of 2003. We're in 2025 now. So it's been a couple years.
Wow.
Yeah, I know. It's been great having you. So when you first started care with us, how bad was it, and how was it affecting your life and well-being at the time? So,
Well, I had gone to work. I worked in the factory, and went in crooked. I mean, just crooked, and it hurt.
yeah.
Well, I had seen an ad
Okay.
to Stone Chiropractic. I think it was $8 treatment.
Okay.
I think it was an ad for an $8 treatment. I went, $8. So at my lunchtime, I came from Flint to here, to his first office, and he adjusted me and told me a little bit about his beliefs in chiropractic. And I went back to work, and by the time work was over, I got home, my wife asked, how was he? And I said, I was straight, I was out of pain, which I know probably there was a lot of chiropractors that could do that. But the difference was he explained a lot of the stuff. He educated me very quickly. And when I came back and he went over things and explained it all, I bought in.
And then, wild to think that you came kind of under a symptomatic model, but here it is 22 years later. So just very important, guys. Like Doug said, educating your patients, I think, is, treatment is one thing, but understanding can go a long way, obviously, like it has.
Obviously.
Yeah. Oh, that's
I
awesome.
realize what chiropractic care does. It doesn't just, it's not just for your back.
Beautiful. Thank you. I'll pay you later, Doug. And you kind of just, the next question was, could you simply briefly explain the path, which you kind of just did? Did you notice any other unexpected improvements with your health while undergoing chiropractic treatment, like anything?
Me personally, I was pretty fit anyways.
Uh-huh.
I don't sit around. My
Yes,
wife,
Doug, when Doug was first a patient, you just reminded me of something. You used to talk about how many days a week.
7 days, 12 hours.
I remember when Doug would say this, I was like, you don't work 7 days a week, you work every day.
Every day.
And
every day for a while there, yeah.
And we're kind of in the Flint area, and this is kind of like, blue collar. This is what we get. This is people are busting their hump at work, and
walking on cement floors all day, and it takes its toll.
Yeah,
it takes its toll.
And great to have staying under chiropractic care as you have to undergo those things every day as you go to work.
And what I've seen mostly is from my wife, Marcia. She's always had a problem with her neck.
Yeah.
And she's been to a lot of surgeons that some say they wouldn't touch it, and others want to do it right away. Doc has kept her from that, from going under the knife. She's not out of total pain, but enough pain that she doesn't have to go under the knife.
Yeah, amen.
So, and any other little quirks that come up, he finds them and he fixes them.
23, and then the cool, but yeah, and I love hearing these. It's not just consistent care, there's so many patients now, I think about it. One guy came, he was about to have plantar fascia surgery. He was about to have some releases done on his foot, and we worked with him, and 23 years later, he still hasn't had that surgery. So that's good stuff. Thanks, Doug. Thank you. All right. Why have you and continue to consistently prioritize chiropractic care into your life? Well, you kind of spoke to that. It kind of keeps you going.
Yeah.
Okay.
Well, and I think about, I'm 70 now.
Are you really?
I'll be 70 in June.
How old's your dad now? How old is your dad?
My dad is 95.
And
He'll be 96 in April.
yeah.
So, and I thought, you know, I don't want to be the guy walking around crunched over, and I've always thought chiropractic care, if I keep me straightened out, maybe I'll.
Yep. So it's not just a symptomatic thing; it's an ongoing maintenance of health. And for you to even, like, with all the physicalness of the nature of your job over the years, to be able to be 70, look great, and move like you do, you know, long-term benefits of chiropractic care.
Yeah.
Oh, awesome. All right. Has Stone Chiropractic also been a good resource regarding other health issues as they arise? And you use any examples? Like,
I don't know about examples. I mean, it's been a long 20 years.
yeah.
And I don't remember, you know, my memory's going. but I do know that there have been instances where we go, hey, that's going on. And you'll go, oh, it's this or that. And
Yeah.
we'll adjust for that. And it always comes out right.
Yeah. Yeah, the nervous system takes care of everything.
Right.
And it's kind of neat, and like Doug said, yeah, it's over the years, it's been, as issues arise, not just what you originally came into, but we can look at it and take it. That's awesome. Good stuff. All right, how important is it, and this is kind of to help the students as far as maybe even looking at this from advice you can give them. This is what these, or help them when they start to see patients.
Mm-hmm.
How important is it for your doctor to have compassion, care, a positive personality, and a desire to educate? How important is that to you?
It keeps me coming back.
Yeah. Yeah.
It keeps me coming back. She might have to add this, but I don't want to go to some asshole.
We may not have that. Amen. It does, but the relationship is important.
It is.
Yeah.
Absolutely.
And education, like you said, education kind of is not just someone adjusting you, but educating you on why things are going on.
Yeah, absolutely.
Perfect.
And I know where you're going next, and I can tell you that the office staff, we look forward to coming here. When we come here, we look forward to seeing the whole staff, because they're all very nice and very cordial, and have a good time with them.
Yeah,
So.
and it's positive. So when you're hiring employees, you know, you want to kind of look for patients who are going to kind of bring themselves up the way you want the clinic to come up, and
Sure.
and
treat your patients the way you want them to treat.
you
want them treated. I mean.
Yeah, and I have to say this, we also look forward to, you walk in the room as a patient sometimes, and you're like, okay, you're gonna have to bring them up, but it's really nice when you guys also energize us, and it helps us to also continue to love to do what we do and do it, so thank you for that. We appreciate you too. All right, let's do this one. Man, this has been all right, here's where you get to, what are some annoying experiences you have had in other healthcare offices that our students should really avoid? So if there's any advice you could give them, I'm like, okay, don't do this, go for it.
Don't have automatic answering.
There you go.
I mean, for one thing, I can't stand it. If I call a doctor's office and a voice comes on that isn't human. I have a doctor, my personal physician I've been going to for longer. I mean, 40 years, almost 50 years I've been going to her. And she's always kept her office staff treating the patients the way she wants them to be treated.
Amen.
And so that keeps the patients happy.
It's hard in a very advancing technological world, but if I can't reiterate this to the students, yes, technology has its place, but at the same time, the consistencies of the types of offices, even businesses that make it, there's still that fundamental humanness.
Person-to-person contact.
Yeah.
I mean, actual, talking to people.
Very important. That's awesome. Yeah, that is awesome. Overall, 22 years of chiropractic care, came in for symptoms.
Yeah.
And now has been allowed us to take care of you for 22 years, other issues as they come up, but can't thank patients. I kind of wanted to bring patients on that have been long-term patients and kind of get their perspective on, and I think I can clearly say that the education, the personal touch, the having a good time in the office, education, understanding is just so important. Thank you for doing this, and thanks for the advice you can give to our students.
Good luck.
Good. Love you, and thank you.
All right.
Thank you.